Good evening and thanks for joining us. I'm Dennis House. At the governor's daily briefing, a glimmer of hope that social distancing is working because cases are growing but not surging. Today we learned more than 1,400 people are currently in hospitals across Connecticut. There have been 49 more deaths in the state since yesterday alone, bringing the total number of people who have died from coronavirus to 326. The state has not yet released its daily tally on total cases and the county-by-county breakdown. The governor did allude to some technical problems in that matter. We do know there is a crisis at nursing homes. The state now says 39% of homes have at least one positive coronavirus case. Channel 3 Eyewitness News reporter Matthew Campbell joins us now with more on that story tonight. Matthew?
Yeah, Dennis, this is something that the governor has been pressed on for about a week now. It has been a week since the state unveiled this plan to dedicate coronavirus nursing home for patients who do have the coronavirus. And precious days have been wasted. Lives may have been lost because this plan has still not been rolled out or at least executed. Let's take you over to Milford right now. This is the Golden Hill Rehab Center. Here more than 40 people have been infected, and this is the most vulnerable population. When the crisis began, there were tragic stories coming from Connecticut nursing homes of residents dying. And what is happening in Milford is exactly what the state did not want to happen. Today, more than a week after unveiling the plan to create these dedicated nursing homes for coronavirus patients, we have some details of what this is going to look like. 2 homes will be dedicated, and a couple of alternate care sites are also being set up. Now, one alternate care site is a closed nursing home that's being reopened. The other is a space on a hospital campus. We know that Sharon, Torrington, and New Canaan will be home to these sites. Combined, all of the spaces will have 420 beds, which hopefully will be enough to care for these coronavirus patients. The actual shuffling and transporting of the patients, that hasn't happened, but this is what it's going to look like.
We anticipate that it will be done with ambulances or transportation vehicles that the facility may have. So because we are asking and expecting it to be a thoughtful process, we expect it will take a couple of days.
Now, we're also hearing from the nursing home employees. They are crying out for help, saying that they don't have the protective gear necessary to treat these coronavirus patients. The state was asked about that today. They say they are working on this right now to make sure these workers have that gear. Dennis.
Matthew Campbell, thank you.